everyone, welcome to Suman TV. I'm Shrishna. Today we are with Dr. Radhakrishna Sagi, who is specialized in orthopedic and also knee replacement surgeon. Let's talk to him. Hello sir.
Hello.
So doctor, a lot of people are suffering from knee joint pains. What could be the common reasons behind it?
I think that's the question probably a lot of people would like to know the answer for.
Yes.
Most of the people will have knee joint pains because of two reasons. One is because of aging.
Okay.
The second one is because of injuries. And when we look at the knee joint pains depend on the different age groups. So we'll start with the older age group, where the older age group people will have knee joint pains because of degeneration, because of aging, where the people will have changes in the joint, where the cartilage between the joint gets degenerated, and that will start giving them pain. The second commonest reason which we see usually in the younger age group is because of the injuries. People who get injured for various reasons can have knee joint pains.
Okay.
So ideally we should probably be talking about the degenerative arthritis, which we see in the age group of 40 plus in women and 50 plus in men, because that is one of the things which we can modify. When people start getting a little knee joint pain without any reason, I mean when they are doing their regular activities, if they start getting the knee pain, that is a red flag for them.
Okay.
They should know that there is some degeneration has started. And if they are finding it difficult to climb the stairs, if they are finding it difficult to get up from squatting position, if they are finding it difficult to climb up the stairs or down the stairs, that means their degeneration is showing them symptoms. That is when people should start taking it seriously, and that's when people should take some advice. Okay. What kind of advice? They should know what kind of lifestyle can modify their progression.
Right.
If people take care of it at that stage, they can still save their knee joints for quite some time. The first things they should do is their lifestyle modification. Like they should avoid squatting, they should avoid sitting cross-legged, they should avoid the stairs. And second thing is they should have some control over their weight. Weight also plays a big role in knee joint pains. The third thing is how strong they are with their muscle strength, also plays a role. So if they can spend some time exercising to reduce the weight, build some muscle around the knee joint, and avoid certain activities, all of them can modify their joint pain. Okay. When it comes to the pain which is persisting, which is gradually progressive, and which pain requires some attention other than this lifestyle modification, that's when they should definitely take a professional help.
Yes.
They should consult a doctor for next steps. Most of the times people will come to a doctor only when the pain is so severe that they can't do their activities of daily living. They can't walk, they have a lot of swelling, severe pain. We shouldn't wait till that time, because by the time you reach that stage, probably you have already delayed it. So the earlier you check and take the professional help, the better it is. Ideally, you should start looking at your knee joints the first time when you get some pain, without any reason. Without any reason, I mean no injury, no specific episode where you have strained your knee, but you are getting some pain. That's the first time you should have. Exactly. Yes. That's the warning sign, and that's the time when you should consult a doctor, so that you can actually have some preventive things what we have discussed.
So in a nutshell, we can always tell that prevention is always better than cure.
Absolutely.
Right.
And this is something which people can prevent. So people should look at it in a preventive manner.
So on the bright side.
Right side. Correct. And if you are already into a stage where you require treatment, a lot of people will do a lot of unnecessary things, and because of lack of awareness, because of lack of time, people go into different kinds of things to get their knee joint pains treated. Ideally, when they have pain, the first thing they should do is they should avoid starting the exercises. Lot of people will do that. The moment they start having some pain, they'll say, okay, I'll start exercising so that I'll get rid of pain.
Okay.
That's the exact opposite.
Okay.
They shouldn't do that at all. You should not do an exercise when you have pain.
Okay.
The exercise is for prevention, not for cure.
Right.
Okay. So you should not exercise when you start having pain. You should get rid of the pain. After that, you should start exercising by a proper advice so that you will not get the pain back again. So what kind of treatments we have? Generally, if you have a sudden increase in pain and if you have some swelling and all that, ideally you should rest it. Give some cold packs, ice packs. No massages should be done.
Okay, not at all.
Not at all. Most of the people, whenever they have severe pain, they'll do hot fomentation and massage. Both of them can aggravate that pain. Okay. So you should avoid hot packs when you have lot of pain, sudden onset of pain, and you should avoid massaging if you have lot of pain. What is ideal? If you can't immediately reach out to a professional, you should just rest it, keep it slightly elevated, and then give some ice packs.
Okay.
And simple analgesics like even a paracetamol can help immediately, but don't go to a unprofessional, take some medication for just immediate relief and ignore it, because that may be the first warning of a big thing for most of the people. And there are a lot of medication which can help, and based on the symptoms, based on what is seen by a professional orthopedic surgeon, they'll give the treatment. Most of the times, if it's a first episode, a short period of medication for pain, swelling will take care of it. And some people will require some physiotherapy. When people realize that they have pain and they started persisting pain is noticed by them, they should definitely take this help. Okay. And when we initially when we start treatment, the medication and rest and probably little physiotherapy is good enough. And most of the times you don't require any investigations also. Okay, don't have to examine it with X-rays, MRIs and all that most of the times.
Okay.
If it's very initial, if it's a first episode and all that. But if you have delayed it, you have pain for months together, you just managed it somehow, then you require the next level. You require probably you need to get it, X-rays done. Sometimes people will require an MRI scan to be done to see what is wrong. And other symptoms like when you're not able to stably stand, your joint is not stable. If you are started to hear the clicking sounds, the clicking sounds which are painful, if your joint is getting locked, you have bent it but you are not able to make it straight. These are the next level of symptoms. If you start having those things, that means you have already delayed it a bit. And that's when people will undergo some investigations like X-ray and MRI. And based on what is found, the next level of treatment will come in. Most of the people will still settle with medication, and sometimes they may actually have to go for injections into the joint. There are possible ways of reducing those things by intra-articular injections which are given into the joint.
Will that help to increase the cartilage between the joints?
It doesn't really help to increase the cartilage, but it will protect the cartilage what is there already.
Okay.
So that is the reason why you should know early that you are still having some cartilage. If you have reached a stage, it's graded as 1 to 4, this degenerative arthritis. If you have reached a stage 4 where there is absolutely no cartilage at all, no injections will work, no medication will work, you have to go for joint replacement only.
Okay, knee replacement
surgery. So you can postpone all these stages if you know them well and if you start attending to them.
Okay.
So the stage 1, most of the people will not come to a professional help at all. Most of them just manage the pain for the very short period of time by using medication and rest, and then ignore it. If they can actually attend at that stage, they can prolong their joint's life. So if they come to the doctor at stage 2, then still you can prolong the cartilage life by giving some viscosupplementation. So some injections like PRPs and all these things are available now. Beyond that, your possibility of saving the cartilage goes down significantly.
Okay.
Your progression is very fast. And when you reach the stage 4, the only possibility is joint replacement.
Thank you so much, doctor, for explaining about major important topics and also for your valuable time.
Yeah, my pleasure. Thank you.
Yeah. And viewers, thank you so much for watching this video.